No, it's downloading. It's almost done. Your slide. So you share your screen once it's done now.
Where is this one?
It's down there.
Okay, you don't know, notice over.
Good afternoon, everyone. Sorry about the break in transmission. Hello, can everyone hear me now?
Yes, we can.
Sorry about the break in transmission. I'm having network challenges. So I was saying that the NGF shares the belief that breastfeeding is beneficial to both infants and their mothers, and exclusive breastfeeding is crucial to child nutrition and development. That is why in 2018, all 36 governors committed to implementing 6 months maternity leave for the civil servants, as well as ensure functional crèches with breastfeeding corners at the state secretariats made available. Between 2018 and now, we have included these two commitments as indicators on the NGF nutrition scorecard, and it has been part of our stakeholders' engagement to see to its implementation. This way, policymakers are held accountable at the highest levels to implement actions that would encourage optimal infant and young child feeding practices in their states. It is encouraging to know that significant progress has been made across the 36 states, although the states are at different stages of implementing these policies. The theme for this year's World Breastfeeding Week, Step Up for Breastfeeding, Educate and Support, is a perfect representation of what needs to be done to achieve the global goals for breastfeeding in Nigeria. We need to educate and support our women, and we all need to step up, take responsibility, and act. Shortly, we'll be hearing from some of our First Ladies, the First Lady of Ekiti State, Her Excellency Erelu Bisi Fayemi, the First Lady of Kebbi State, Her Excellency Dr. Zainab Shinkafi Bagudu, and the First Lady of Ogun State, Her Excellency Mrs Bamidele Abiodun, who have been persistent in supporting women in their various states to ensure that the governors put in place family-friendly policies to increase breastfeeding rates. We will also be hearing from representatives of the state committees for food and nutrition for Ekiti State, Oyo State, and Kaduna State. These are 3 of the 4 states that have implemented the 6-month maternity leave policy for civil servants. They will be sharing their experiences so other states can learn from them. On behalf of the Nigerian Governors Forum Secretariat, I would like to welcome you all to this event. I implore you to participate with your full attention, as well as prepare to step up for breastfeeding. I'll be handing over to Isioma Ononye to moderate the panel session. Thank you very much for attending the webinar. Over to you, Mariam Laushi.
All right, thank you so much, Madam Hawa, for sharing some of the achievements so far. As Save the Children, we would like to congratulate the states that have so far begun to implement the maternity leave. And I would like to also inform everyone on this call that as Save the Children International, every woman is entitled to 6 months of maternity leave as well. Right now, I want to introduce the country director of Save the Children International here in Nigeria, Famari Barrow, who will be giving a goodwill message. Thank you.
Good afternoon. Your Excellency, the First Lady of Ekiti State, Erelu Bisi Fayemi, Your Excellency, the First Lady of Kebbi State, Dr. Zainab Shinkafi Bagudu, Your Excellency, the First Lady of Ogun State, Mrs. Bamidele Abiodun, distinguished members of state assemblies, honorable commissioners, permanent secretaries, directors, deputy directors, CEO of various organizations, representative of civil society organizations, dear friends of the media. Ladies and gentlemen, it is with great pleasure that I present this goodwill message today as the world marks World Breastfeeding Week. Before I start my speech, I would like to brief this forum on Save the Children International. Ladies and gentlemen, Save the Children International has been working in Nigeria since 2001 to ensure all children survive, learn, and are protected. The work to protect all Nigerian children from all forms of violence, neglect, and marginalization, especially girls, orphans, vulnerable children, and children affected by conflict. Our program works from the community to the national level to promote children's rights and protection. We also campaign to ensure that girls have equal access to education and are protected from child marriage. We are contributing to strengthen the capacity of health workers and support in strengthening of health systems in Nigeria to treat and prevent malnutrition and deliver low-cost intervention that save newborns' lives. Ladies and gentlemen, we are also part of a consortium working to ensure that all children are immunized and advocate for increased government investment in health and nutrition. And we work to address the root causes of poverty and mitigate their impact on children by strengthening the livelihoods and resilience of households. Our humanitarian work provides child-friendly spaces where children can learn, plan, and receive the support they need to recover from trauma. We also set up temporary learning spaces and support the re-enrollment of out-of-school children so that all children can have education and contribute to the development and growth of the nation. Ladies and gentlemen, we commend the Nigerian government for all their efforts to improve human capital development as well as position Nigeria to accelerate progress towards achieving universal health coverage and the Sustainable Goal Development. We are aware of the nutrition scorecard which Nigerian Governors Forum is using to draw attention of state governors on the impact of malnutrition to the growth and development of the country. Ladies and gentlemen, Save the Children International is happy to work with Nigerian Governors Forum to improve the nutrition.
This Nigerian Governors Forum.
Okay, I'm supposed to be part of it.
Yes, now I sent it to you.
No, they sent me to me. They sent me.
Hello, thank you so much. Could you please mute your mics? Thank you so much.
Okay,
Please go
sorry
ahead,
about
Mr. Barrow.
Sorry about that. Ladies and gentlemen, Save the Children International is happy to work with the Nigerian Government Forum to improve the nutrition landscape in Nigeria. Save the Children and the Nigerian Government Forum are members of technical advisory group set up by the Vice President of the Federal Republic of Nigeria to support National Council of Nutrition and provide guardians and the implementation of National Multi-Sectoral Plan of Action for Food and Nutrition and Costed Plan. We are happy with that coming from these engagements. Save the Children is open to more collaboration with Nigerian Governors Forum in the future and in the interest of the Nigerian children. Ladies and gentlemen, Save the Children is working to influence policy, adoption, and implementation, which is critical for the quality delivery of maternal and child health and nutrition services, as well as advocate for adequate funding and strengthen coordination and accountability framework and mechanism. Your Excellencies, in conclusion, as you know, the theme of this year's World Breastfeeding Week celebration is set up for breastfeeding, educate, and support. It focuses on strengthening the capacity of actors that must protect, promote, and support breastfeeding across different levels of the society. Save the Children believes strongly in inclusive breastfeeding, exclusive breastfeeding, and will continue to advocate for enabling policies that support lactating mothers and their babies. All over the world, breastfeeding is believed to be the single most cost-effective intervention that gives everyone a fair start in life and beneficial to the health, well-being, and survival of under 5 children and their mothers. Distinguished guests, as this webinar commences, I would like to appreciate Your Excellencies, the Nigerian Governors Forum staff, the Nigerian Governors Forum, staff of Save the Children, and all our attendees for making this webinar possible. Our goal is to ensure that our collaborative effort makes a difference for Nigerian women, children, and the country as a whole. Thank you very much.
I don't have any numbers.
Thank you, sir.
Thank you so much, Mr. Barrow, for your goodwill message. We'll be going into some addresses from Her Excellency, the First Lady of Ekiti State, Her Excellency, the First Lady of Kebbi State, and Her Excellency, the First Lady of Ogun State. And so I will hand over now to Madam Hawa Haliru Hassan, who is the Head of HR and Corporate Governance at the NGF, to moderate this session. Thank you.
I think, Madam Laushi, you can continue with this. Hello? But you can continue.
Apologies for that.
Yes, can you please continue? Thanks. Yeah.
Yes,
Okay,
apologies for that. Yeah.
Okay, thank you so much. It's really an honor and a privilege to have our distinguished guests joining us to share their messages on this World Breastfeeding Week, which is important for women in Nigeria. We also would like to acknowledge their work so far in terms of women's health, women's rights, and bettering the environment for Nigerian women and children in general. So I would permit me the honor to introduce the first person who will go ahead to speak in no particular order. I would like to ask the First Lady of Ekiti State, Her Excellency Erelu Bisi Fayemi. I would like to welcome her now to share her own message. Thank you.
Thank you very much. I'm really delighted to be here this afternoon. I acknowledge all the partners who have put this together, and the Nigeria Governors Forum, the staff of Save the Children International Nigeria, and also the country director of Save the Children did not add that it's also in collaboration with the Nigeria Governors Wives Forum. We were joking amongst ourselves that we are sure that the Nigeria Governors Forum got stuck when they were trying to figure out how to talk about breastfeeding without involving their wives. So it's really great to be here on this collaboration, and I acknowledge my sisters who are on the call here with me, Her Excellency the First Lady of Kebbi and Her Excellency the First Lady of Ogun State. Distinguished ladies and gentlemen, it's an honor to join you at this virtual commemoration of World Breastfeeding Week 2022. I would like to acknowledge the significant work that has been done by government and partners across the country to support and encourage breastfeeding as a critical part of child nutrition and health. I would also like to welcome everyone present today who has taken time out to join in this conversation. It is concerning that though the benefits of breastfeeding have now been proven beyond argument, less than 50% of Nigerian women feel encouraged, enabled, or empowered to exclusively breastfeed their babies for up to 6 months. This stands in stark contrast to that of other African countries, where nearly 70% of women have high rates of continued breastfeeding up to at least 1 year of age. It is, however, encouraging to see that some states in Nigeria have taken bold steps to encourage exclusive breastfeeding, And we have examples from Ekiti State, Lagos, Oyo, and Kaduna, who have implemented the 6-month maternity leave policy for civil servants. Akwa Ibom, Imo, Kwara, and Ogun states also have functional creches at their government buildings, and I'm sure Her Excellency Ogun will tell us more about that. And I believe that most states are making significant progress. In spite of these achievements, if we will meet the WHO target of 50% exclusive breastfeeding by 2025, we will need to massively scale up efforts, ensuring that other states are brought up to speed and that no child in Nigeria is deprived of the nutritional, immunological, and psychological effects which breastfeeding provides. This gathering is therefore an opportunity for us to share lessons in breastfeeding programming and deliberate on issues that are stalling progress on achieving the WHO recommended 50% exclusive breastfeeding rate, which is currently at an abysmal 28.7% in Nigeria. I look forward to engaging with all stakeholders on best practices to address prevailing issues and a collective resolve to strengthen intersectoral and institutional collaboration towards improved breastfeeding. As the theme for this year's World Breastfeeding Week suggests, we as stakeholders need to step up plans, policies, interventions, and all possible collaborations towards achieving our goal by 2025. I hope we can address some contextual issues of concern in our communities, such as women's poverty and poor nutritional status, access to livelihoods, and lack of enabling environments to encourage extended breastfeeding. I believe that this webinar will rekindle commitment to increasing exclusive breastfeeding rates in Nigeria and proffer solutions to other issues affecting child nutrition in Nigeria. Nigerian governors' wives play a key role in community mobilization, sensitization, and high-level advocacy. We have all been engaged in advocating for change in the areas of sexual and gender-based violence, drug abuse, cancer prevention and treatment, poverty alleviation, and girl-child education. At the Nigerian Governors' Wives Forum, we are therefore committed to working together and with partners to ensure that all women in Nigeria have the support they need to breastfeed and that childhood malnutrition is drastically reduced by 2025. As the chair of the Nigerian Governors' Wives Forum, I can assure you that you can count on us to be tireless champions for breastfeeding in all our respective states. Thank you for your attention, and I look forward to working with you all.
Thank you so much, Your Excellency. I'm sure I speak for Nigerian women by saying we are happy to hear this statement and commitment from you. And it's reassuring to also know that. And our hope is also that Nigeria would reach the recommended 50% to ensure improved nutrition and a better start in life for children all over the country. Thank you. So I will be moving on now to the next speaker. And I would like to introduce Her Excellency, the First Lady of Kebbi State, Her Excellency Dr. Zainab Shinkafi Bagudu, who will also share her own message. Thank you.
I need to share. Can you allow me to share my screen? Oh, okay. So I can't see the screen. Can you allow me to share my screen?
Sure, I'm sure they will get on that in admin. If you could kindly.
Good afternoon, everyone. Good afternoon, Your Excellencies, my sisters, the Governors Forum, Secretariat organizing this, and of course, to our partner, the Country Director of Save the Children, Mr. Barrow. I have a short presentation to make, which gives us an idea of what we've been doing in Kebbi. Her Excellency Erelu Bisi Fayemi has already given quite a good summary and concise of the situation in most of Nigeria. We unfortunately are way below the targets for breastfeeding, and this is something that we as mothers of our states and the chief advocates are very passionate about. We would like to see an improvement in this, and through our offices and our various foundations, we work very hard to ensure that this happens. For me, one of the key, the other key trigger or factor that makes me very passionate about breastfeeding is the fact that breastfeeding offers protection against cancer of the breast, and this is a very important factor in public health for us. The more we breastfeed, the less the chances of a woman are of having breast cancer in her life. I'm still not able to share my screen. I don't know if can you see my screen?
You can share your screen, Your Excellency. Just click on the share screen and share. We've enabled you.
I'm logged in on 2 devices, so. Apologies. So I'll present from that. So can I leave this? Can you see the screen now? Hello?
Yes, we can.
Yes, we can.
We can see your screen.
So like I was saying, in the past we have had issues, or we still have issues with breastfeeding, and this is one of the reasons why the World Breastfeeding Week has been started. For us in Kebbi, we have instituted a lot of programs that aim to improve the rates in the state. In particular, in my office, one of the major achievements that we have been able to come up with is the institution of the breastfeeding rooms across the state. We've been able to have three of the government institutions, the main federal secretariat, and 2 other local government areas, Shiga and Ogun. In addition, we're able to set up a mother's room, state special baby care units in the Federal Medical Center. The doctors realize that babies are born, and especially for the ones on admission, there is a lack of bonding or separation between the mothers and the babies, and this doesn't allow them to institute breastfeeding properly. So with the help of the state government, we set up a mother's room, which has been in existence for at least about 3 years now. And this has been coming to help the mothers stay near their babies so that they can, this has been coming them. There's also the issue of poor attitude to breastfeeding, especially the exclusive breastfeeding that we target or that we preach. A lot of women in our environments are not the key decision makers, and sometimes this makes it very difficult for them to continue to breastfeed when they want to, or during illness, they have to go by the say of the culture, and sometimes their husbands and family. We've also made significant progress in that regard. by working with civil society, government institutions.
We've also made
continue
with civil
to
society
advocate and to create awareness
on the importance of breastfeeding.
The maternal and child health week has offered us a good opportunity to carry out infant feeding advice, both with breastfeeding and other weaning methods and things that the mothers should be doing correctly. There have been various studies carried out in Kebbi, one in particular in Dampo Osagu in 2020 that showed that the prevalence of stunting was quite high and still above 40%. There are figures that quote up to 90% in Kebbi State. And this, although we've seen some improvements, it still remains a critical issue and one that the government is concerned about and doing a lot in terms of improving the nutritional status of mothers. Volunteers, with the contribution of organization partners like Save the Children, had an ongoing program in Kebbi. UNICEF, Breakthrough Action, which is a USAID funded program, they all work together to improve the habits and culture and behavioral attitudes of our women. We carry out programs to try to incentivize such practices, healthy practices like going to the hospital, receiving the advice from the midwives, during which we distribute items like Pampers and things that will be beneficial to the mothers. Like I mentioned, we launched the first breastfeeding room in 2017, and this was in the Kebbi State Secretariat in Bodangwaji. It was commissioned by Her Excellency Hajia Aisha Muhammad Buhari, and we've been able to continue this trend since then, with the support, I must say, and commend the local government chairmen in our states. So I think that in summary, okay, we've included a little bit about breastfeeding and cancer, which I will just quickly go over, although this is not a cancer webinar. There are known studies, very well proven studies about the link of reduction in breastfeeding and reduced breast cancer. Over 40 studies have revealed a 30% reduction in the risk of ovarian cancer as well, when you compare women who have breastfed compared to those who didn't breastfeed. There's also a common question that women always ask us about developing breast cancer during pregnancy, during breastfeeding. What happens is because of the hormonal play that comes into a woman's when she's pregnant and breastfeeding, it tends to become manifest around that period. So we do see a lot of women that are either in pregnancy, the breast cancer comes up at that time. But actually, breastfeeding in itself confers some degree of protection on women later on in life, again due to the hormonal play. Mammograms, another common question. Are they able to have mammograms and have breast screening during breastfeeding? It may be uncomfortable and very difficult, so it is advised not to do that. Finally, another common question we come across is the use of cancer treatment during breastfeeding. It is possible, and sometimes we have no choice but to go ahead. And so we, unfortunately, these are the kind of situations where one has to advise breastfeeding is stopped because of the toxicity of the drugs that a mother with breast cancer might be undergoing. So once again, I thank the organizers, and I hope that some of what I've said will encourage us and help us to do more. We're grateful to the governors of our states for the support that they give to us. We're still advocating for improved paternity as well as maternity leave in Kebbi State, but there has been an improvement, but unfortunately, we haven't been able to get it passed by the House yet. So thank you very much for listening.
Thank you so much, Your Excellency, for this very insightful address that you've given today. It's interesting to know the level of research that is being done in Kebbi State, as well as the efforts that are being done. And also thank you for sharing the further benefits of breastfeeding. All right, I will be moving on now to Her Excellency. Mrs. Bamidele Abiodun, the First Lady of Ogun State, who will also be sharing her own comments with us. Thank you.
Thank you very much.
Obiora Anibede, kindly mute your mic, please. Obiora Anidebe, kindly mute your mic. Thank you.
Good afternoon, everyone. Her Excellency, the First Lady of Ekiti State, Chairperson Erelu Bisi Fayemi, Her Excellency, the First Lady of Kebbi State, Dr. Hajia Zainab Bagudu, Country Director, Save the Children International Nigeria, Mr. Famari Barrow, the Nigerian Governors Forum organizers, and everyone else on this call. Good afternoon to you all. As Her Excellency, the First Lady of Kebbi has said, Her Excellency, the First Lady of Ekiti State, our chairperson, has given an overview to stepping up, a general overview to stepping up to reaching the recommended 50% mark for us in Nigeria, which is general for everyone. But I will now speak a little about what we are doing in Ogun State, or what we have been doing. Thank you all once again to the organizers and the specialists present today, especially the Nigerian Governors Forum and the Nigerian Governors Wives Forum. I greet all the other members of the Nigerian Governors Wives Forum that are present here, and Save the Children for putting together this breastfeeding at the front burner of maternal and child health in our country. Today, I'd like to speak briefly on our work in Ogun State, supporting breastfeeding initiatives and encouraging our mothers to breastfeed their children exclusively. In the height of the coronavirus pandemic in 2020, our focus was around strengthening the capacity of key stakeholders to protect, to promote, and to support breastfeeding in different communities across the state. Working with the Medical Women's Association of Nigeria, M1, we sought to emphasize that COVID-19 could not be passed from mother to child through breastfeeding. Last year, we expanded our breastfeeding advocacy, working with nurses and midwives in primary healthcare centers. Our focus was primarily on the health benefits of breastfeeding, which include, of course, we all know, nutrition, preventing infections for mother and child, helping in weight loss for the mother, quick recovery from postpartum bleeding, bonding, increased immunity for our children. And our advocacy work was simple and effective. We created sensitization materials for radio, television, and social media. With support from the Ogun State Ministry of Health, we incorporated breastfeeding advocacy into our maternal and child health program, starting from January this year. We have also advocated for employers to support family-friendly policies that encourage breastfeeding for working mothers. This is still work in progress. When we went around in 2022, we went to all the local governments. I went to quite a few myself. I mean, I'm a mother of 5 children. I exclusively breastfed all my 5 children. So I explained to the women, we Africans are trying to imbibe cultures that are not ours. This culture of breastfeeding is not just African, it is global. But because we are trying to be fancy, a lot of our people believe that it is an elite thing to have to bottle feed your child, not throwing away all the benefits of breastfeeding. So we have to keep telling our women that there's nothing wrong with not being able to afford baby formula. It is safer for your children, better for you on the long run to breastfeed your children. There's no need for you to now start going to look for money to buy formula, to buy bottles, trying to, a lot of children get infected with different diseases because their bottles are not kept properly. The market women throw their children's bottles all over the place and they put their feed there, etc. All sorts of disadvantages bottle feeding. So, but we try to tell our women these things, that there's nothing wrong with breastfeeding your children and carrying them everywhere you go. I carried all my children from the age 0 to age 2 everywhere I went, and anytime I had to breastfeed, I'd go into a corner somewhere, cover myself with a shawl and breastfeed. So we need to try and continue to advocate to our women the importance of breastfeeding. And of course, it is so important for bonding as well. When you're breastfeeding a child, you're looking into the eyes of the child is looking into your eyes. Your heart is placed right by your child's heartbeat, so it's in sync with your child's heartbeat. So there are many benefits that people just need to, and they're not very difficult to understand. We just need to let them know, and also give them examples of people who, I think it was the president of New Zealand that took her child to the United Nations and went to breastfeed the child. We should let our people know that there's no shame in breastfeeding out in public. So our advocacy work, like I said, was very simple and effective. We created sensitization materials for radio, television, and social media. With the support from the Ogun State Ministry of Health, we incorporated breastfeeding advocacy into our maternal and child health program, starting from January this year. We have also advocated for employers to support family-friendly policies that encourage breastfeeding for working mothers. That is still work in progress. I just repeated that intentionally. Part of our advocacy is towards tackling myths surrounding breastfeeding, especially for young mothers. Some of the myths range from medical-related issues to social issues, like the belief that breastfeeding causes the breast to be sag, to be flabby. As mundane as it sounds, these are real concerns that can cause some not to breastfeed, especially first-time mothers. And it's why our advocacy must continue. There are also others who believe that breastfeeding should be augmented by other meals like pap or baby formula or water. You don't need water because 70% of the breast milk is water. So again, these are practices that take place in the modern world and can only be addressed through continuous sensitization of our people. In terms of what more can be done to promote exclusive breastfeeding, I believe that expanding existing advocacy programs to reach more people is critical. Also, more should be done to promote family-friendly workspaces in the public and private sector. Some companies already have breastfeeding rooms for nursing mothers. This will definitely increase productivity and reduce worry for mothers who want to hurry back home to feed their babies. So we should look for organizations that can partner with us to champion breastfeeding as an internal policy. The best countries and organizations are those that are family friendly, and breastfeeding is the core of the family. These are my immediate thoughts around what we are doing in Ogun State and my brief recommendations. I hope to hear more from the experts on this webinar. Thank you very much.
Thank you so much, Your Excellency, for further sharing some of the benefits in terms of the economic and social advantages of breastfeeding. And it's also interesting to hear the work being done at the grassroots level, as well as your recommendations for institutions and all levels of society to further encourage breastfeeding among Nigerian women. So with that, I would like to thank the members of this session of the activity. You've shared very insightful and important views with us, and we're very grateful for the opportunity to hear you speak on these things that you actively work on. Thank you so much. With that being completed, I would like to welcome Ishoma Ononye, who is a social media officer at the Nigeria Governors Forum, and she will be moderating the next session and also introducing it and the panelists. Over to you, Ishoma.
Thank you, Miriam. And also thank you to Your Excellency, First Lady of Ekiti State, Madam Bisi Fayemi. Thank you to the First Lady of Ogun State, Mrs. Bamidele Abiodun, and the First Lady of Kebbi State, Your Excellency, Dr. Zainab Bagudu. Thank you for your presentation, and thank you for the work that's being done on your state level to encourage family-friendly policies around helping mothers and supporting breastfeeding. So for this next session of the webinar, we would be talking about how breastfeeding is being incorporated in different states such as Ekiti, Lagos, and Kaduna states, and the work that is being done to ensure that there is the implementation of the 6-month maternity leave policy for civil servants and creation of creches in public office states. So in these panel sessions, we would have 3 representatives. We have Mr. Bashir Mohammed, who is the Permanent Secretary of Planning and Budget Commission for Kaduna State. We have Mr. Moruf Oyetunji, who is the Director of Planning representing Permanent Secretary of Oyo State. We have Mrs. Bolanle Oluyomi, who is the State Nutrition Officer for the State Primary Healthcare Development Agency in Ekiti State. And I would like to start with Mr. Bashir Mohammed. Sir, are you on the call?
Yes, I am. Thank you, Onoye.
Yes, you're welcome, sir.
Thank you,
Thank you.
Yes.
To start the panel discussion, I would like to know what are some of the steps that have been taken in your state to promote breastfeeding among mothers?
All right. Thank you, Onoye. My name is Bashir Mohammed MNI, the Permanent Secretary, Planning and Budget Commission. Let me start by congratulating us on this great occasion. First of all, my greetings to Her Excellency, the First Lady of Ekiti State, who is the chairman of this meeting, other excellencies of Enugu State, Kebbi State, and other SNET are present here, and then all other members. Good afternoon. For Kaduna State, malnutrition and nutrition-related issues continue to be one of the major health concerns, particularly considering how malnutrition manifests itself mainly as undernutrition, overnutrition, and micronutrient deficiencies. However, there is close relationship between malnutrition and underdevelopment, which has continued to be emphasized, particularly at the various international summits aimed at improving the welfare of women and children. It is against this backdrop that upon assumption of office, the present government under the able leadership of His Excellency Mana Nasur Ahmed El-Rufai demonstrated strong commitment and political will to eliminate malnutrition among all children in the state, that it declared a state of emergency on nutrition in order to address the severe acute malnutrition affecting under 5 children in the state. Also, through the development of relevant food and nutrition related policies, strategies, and operational plans, which was approved to guide the translation of this commitment into a full-fledged accomplishment. This is some of the activities this is some of the initiative that the Kaduna State government initiated right when His Excellency came into office. In fact, this administration deemed it fit and very necessary to not only allow for 6-month paid maternity leave, but has gone a step forward further to approve the establishment of creches across MDAs as part of its sustained human capital development effort across the Kaduna State government. So far, in my own office here, Plan and Budget Commission, we have a crèche where nursing mothers came with their children, and then the breastfeeding is guaranteed. And then other MDAs such as Ministry of Health, Ministry of Human Services, and they are also establishing the creches so that the breastfeeding by nursing mothers is allowed. This is the area where we feel, the steps that we have taken. We have been meeting with many development partners on particularly food and nutrition, such as the Kaduna State, such as the State Plan of Action, UNFPA, UNICEF, and REAM, including Save the Children. Not forgetting the CSON, which is also another international donor agency that we'll be meeting together with them, which led to the emergence of Kaduna State Emergency Nutrition Action Plan. These agencies also assist, in improving the breastfeeding in Kaduna State. And you asked about how we Kaduna State government implement or initiative that promotes breastfeeding among mothers. These are some of the activities that we Kaduna State initiated in tackling or in handling such activity.
Yes, I want to commend you on the fact that you've been able to establish creches among your MDAs, which is very essential, and the fact that you're trying to eliminate malnutrition against under 5 children. And also, I just also want to I understand that our First Lady of Anambra State is in the call, and I just want to recognize her. And you're welcome, ma'am. Also, moving forward, another thing that I want you to address is what are some of the key lessons and advice that has been produced from implementation of the 6 months policy? Well, how has the state continued to benefit from this?
Yes, so far, you see, the essence of this initiative is to reduce infant mortality rate and also reduce expenditure on childhood killer diseases. So I think going by this, apart from even the state apparatus, the advocacy that we've been engaging our civil society organizations help in reducing infant mortality rate. And you see, this is a state. And then before now, we've been spending a lot of money in terms of addressing infant mortality. But because of this initiative, this had reduced the infant mortality in the state. And the funds spent on on childhood killer disease has also been reduced.
Okay.
She just called.
Sorry, continue, sir.
Okay, I said you asked about the, let me say, the impact it has on the, on the state. Yes, I said that it has reduced the infant mortality rate in the state and also reduced expenditure on childhood killer diseases. I mean, the introduction of this 6 month maternity leave by the state government to nursing mothers has tremendously reduced that, because apart from Kaduna State government, there are other people who, based on our initiative, have also come to understand that this is an important initiative to allow nursing mothers have some time, to breastfeed their children until they reach a certain age. So these are some of the advantages we've got. That.
Thank you, sir. And just a few moments, I would like to call in the HR of Governance in Nigeria Governors Forum to introduce our First Lady again of Anambra State, Mrs. Nonye Soludo. Just a few moments for that. Thank you.
All right.
Your Excellency, Mrs. Nonye Soludo, we welcome your presence to this wonderful webinar. We would love to hear in 2 minutes what your state has done around maternity leave and breastfeeding programs or policies that have been implemented in your state. Thank you for honoring our invitation.
Thank you so much. Thank you, everyone. Thank you, Your Excellencies. I'm so glad to be here with you. I'm just coming from where we flagged up the Breastfeeding Week program. And I'm just happy to see that women are really into the breastfeeding, exclusive breastfeeding program. We met with about 300 and something of them that are doing exclusively breastfeeding for 6 months, and the children are looking so good. A lot are being done. I just came back and we just entered, we just got sworn in not long ago, but a lot is being done on that because women need that 6 months to take care of these children. I have 6 children and I did all exclusive breastfeeding, and I know the benefits. I know it's very, very vital for the children and the mom too. So we are doing a lot. I need to still have time to sit with my commissioner and the people involved to see, all that is being done towards that. I told the Commissioner of Health, Commissioner for Women Affairs, that we need to meet to see how we'll help women do that effortlessly, because we need to get that for them to be able to do that, because it will be difficult to be going to work and doing exclusive. I don't think it would be very difficult. So we are working on it. I seen it, honestly speaking. I knew, and I live in London. I just came in. So we'll still need time to catch up and see how we will help them get that, the 6 months leave to be able to do exclusive effortlessly. Thank you so much. Hello.
Thank you, Your Excellency. Thank you for sharing your work in the States and your experience. Thank you. Yeah. Isioma, over to you.
Yes, thank you, ma'am. Thank you, Your Excellency, for that. It's good to know that you would be coordinating with the Commissioners of Health to see what more you can do in your states to support mothers and breastfeeding. Now, to go back to the panel discussion, I want to thank you again, Mr. Bashir, for what you are doing in your states. And to reiterate what you have done again is to establish some creche for breastfeeding and the overall impact that it has helped in reducing infant mortality. And now I want to also move on to our other speakers in this panel discussion.
Excuse me, please. I just wanted to point out that another colleague is on the call as well. Her Excellency, the First Lady of Enugu State, Excellency Monica.
Good afternoon, sisters, and good afternoon, everybody. Can you hear me?
Excellent.
Good afternoon.
Good afternoon.
Good afternoon.
Afternoon. Okay. Good afternoon. Just a brief of what we've been doing in Enugu State. Like when I came in, I'm trying to work out a lot of things with Ministry of Health and my own state Commissioner of Health, which we started since 2017. And I also have some organizations that supply me vitamin E and vitamin A for kids under 5 years, which we've been, going around doing medical mission and sensitizing women. Then the aspect of breastfeeding, for me to encourage them, I was able to open a crèche at our big secretariat. And I also talked to the head of service that they should try and open a crèche. At least every department should have, no matter how small, a crèche for mothers to breastfeed their kids while we are waiting for the approval of 6 months maternity leave. I'm on His Excellency, and very soon he will approve. I know Ekiti, they take last. She's always there, so I'm chasing her. Very soon we will approve our own, but the aspect of encouraging women, even during maternal week, because most times I have people who gave me drugs I supply. I'm even trying to, support Imo, Abia, Delta. I've introduced Akwa Ibom. So we have these drugs that we attend antenatal with the women. We give them multivitamin for the pregnant women and vitamin A for the children. So I want to encourage, because with Mrs. Chair, I know how she pushes us like no man business. I know governors' wives, we are going to do a lot when it comes to breastfeeding, and we are going to encourage every state to, just like what we did with gender-based violence, where we had to force our husbands to implement a lot of things for women. So we are also, I'm sure with her, we are going to, be on her husband so that this 6 months maternity leave, they will give to women so that kids, because without breastfeeding, we all know. So we need to encourage that, and which we've been doing. And I've been working with the local government chairpersons. Most times I work, we need to work with the local government chairpersons because they are the platform to get to the rural area. So I work with them, we encourage men. Once in a while, we attend antenatal clinic with women to encourage them to attend antenatal, breastfeed their children exclusively at least 6 months, but if they can, 1 year. So that's how far we've gone in Enugu. And we're still, even if I'm out of this place, my NGO will continue doing that because the people supplying me with drugs, they will keep on supplying me with drugs, and I will keep on working with the women and hospitals to help women breastfeed exclusively, and we watch our children nutrition. Thank you.
Thank you, Ma. Thank you, Ma. And I also want to just commend you again for your efforts to ensure that a creche was open in the Secretariat, that every department should have that, and for your continuous effort in knowing that an NGO, your NGO would continue to take up the work. You are not still continuing the governorship. Thank you for your efforts. And I want to go back to the panel session and introduce our next speaker, who is Mrs. Bolanle Oloriyomi, who is the State Nutrition Officer of the State Primary Healthcare Development Agency in Ekiti State. You are welcome.
Moderator, can you kindly ask the gentlemen who are playing cards to switch off their video? I know many of us like to multitask when we are on webinars, but we'd rather not be part of your card game.
Benga, can you please, you have the host.
We will take off the video.
Benga.
Can I please take them off?
Yes, we will stop their video.
Please don't.
Also, please encourage everybody to mute their mics. Please kindly mute your mic. Thank you. Please, everybody, kindly mute your mic. Okay, yes, I want to recognize Mrs. Bolanle Oloriyomi. Are you on the call, ma'am?
Yes, good afternoon.
Yes, thank you. If you could just tell us just a little bit about what is being done in Ekiti State and whether you plan to extend it towards the private sector, and also just share some lessons learned there. Thank you.
Thank you. Good afternoon, Her Excellency Erelu Bisi Fayemi, Her Excellency Dr. Zainab Shinkafi of Kebbi State, Her Excellency Mrs. Bamidele Abiodun, the First Lady of Ogun State, and Her Excellency Mrs. Noye Soludo, the First Lady of Anambra State. Please permit me to stand on the existing protocol. In Ekiti State, the maternity leave has been extended to 6 months. And what we actually did was that we understood the fact that there was a challenge. And the challenge was that the exclusive breastfeeding rate for Ekiti State was at 39.8%. This is according to the Nigerian National Health Survey 2014. And this was below the global target of 50%, which was believed to be this due to the short maternity leave. The maternity leave before now was 4 months. So after identifying this challenge, we believe there was a need to proffer a solution to this by pushing a bill to extend the maternity leave from 4 months to 6 months. So what we did was we involved the necessary actors, which will help us in creating this policy that will effect the change in the EBF rate. So an high-level advocacy meeting was organized by the State Committee on Food and Nutrition, which is domiciled in the Ministry of Budget and Economic Planning, in collaboration with the State Primary Healthcare Development Agency and the Ministry of Health. And this
Ma?
Hello?
Yes, you're on. Yes, continue.
Okay. So during this advocacy meeting, we had all the stakeholders involved in policy making, and this comprised of the members of the House of Assembly, members of the State Executive Council, and other relevant public office holders. So they were sensitized on the need to extend the maternity leave from 4 months to 6 months paid maternity leave for civil servants. So after the meeting, they were made to realize the need to pass this bill, and there was assurance from the stakeholders that this will be done in due time. So there was a follow-up by the Director, Multilateral Relations, and the Chairman of the State Committee on Food and Nutrition, that is the Permanent Secretary of the Ministry of Budget and Economic Planning, to fast-track the process. So after the bill was passed, it was approved by the State Governor, Dr. Fayemi, and there was a circular which was published and issued by the Office of Establishment and Service Matters. So and also the State Public Service Rules booklet was also revised to reflect this and other changes in the civil service. So right now, the paid the 6 month paid maternity leave is being effected in the states, and it is enjoyed by all the civil servants, both at the LJ and at the state level. So for you said, how do I think that the private sector and the informal sector can benefit from this?
Yes, ma'am.
Yes. For instance, during this year's World Breastfeeding Week, we have been able to do some sensitizations through the social media. We have been on the radio to sensitize the private sectors on the need for them to extend the maternity leave to 6 months for their workers. So, and also the government can also implement additional policies. Like we have policies like maternal protection and entitlement, which protect and support mothers. For instance, we have countries like Indonesia who has this kind of policy in place. Although it can be financially demanding, but it's a very good policy if it can be also extended to the private, the informal sector. The informal sector comprises of those people who are working on their own, for instance, like the street hawkers, like the roadside sellers that are not being paid by the state government. So this kind of policy can be put in place if the government can afford it, because it is believed that this kind of policy is economically attractive as it amounts to less than 0.5% of the GDP. Then also, we have been known to understand that investing in maternity production for mothers working informally is a form of social justice that creates better conditions for women to exercise their choice and may protect their rights to breastfeed. And we know that the best investment for any state or country is to engage in programs that support exclusive breastfeeding. So we have a program already in place in Ekiti State, the 6 month paid maternity leave. And also, I'm happy to tell us that it has also been extended to the male civil servants for the males. Now they have 2 weeks paternity leave. So any male civil servant that the wife delivers can still go home and be with the wife, support the wife to breastfeed for the first 2 weeks that the wife delivers. So another way that this can be extended to the private sector and the informal sector is continued sensitization. We need to continue the sensitization of the mothers on the importance and benefits of maternity leave and how they can work out strategies on their own to plan effectively for days that they should be on leave. Then lastly, the fathers also can be sensitized on the benefits of breastfeeding and maternity leave and the need to support their wives while breastfeeding. Thank you.
Thank you very much, Ma. To reiterate what you said, we have to commend your efforts. So claps to you also for being able to push that bill from 4 months to 6 months. And also the fact that it has also been extended towards the men also. The men are not left out as they have 2 weeks paternity leave. And I think it's great to know that one of the ways to push things forward is that to have continued advocacy and sensitization so that mothers know the benefits of breastfeeding. Thank you again and continue to commend you in the work done in your state. And now I want to move forward to our third speaker, and that is Mr. Moruf Oyetunji, who is the Director of Planning representing Permanent Secretary in Oyo State. Sir, you are welcome. Sir? Mr. Moruf? Okay, it appears
good afternoon, House.
All right, good afternoon, sir. You're welcome to the webinar.
Let me start by recognizing the presence of all the First Lady in the House. You are most welcome. I also wish to recognize the attendance of all the invited for this meeting, invitees for this meeting. Thank you.
Who is doing it?
I am Oyetunji Moruf Abiodun, the Director, Development Partnership, Ministry of Budget and Economic Planning, and not Director of Planning, Ma. I am Director, Development Partnership. Standing
All right, sir. Thank you.
Standing in for the Permanent Secretary.
All right.
Thank you. Yeah, before the present administration came on board in Oyo State, the female employee usually enjoyed 4-month maternity leave. But when the present administration came on board, it was reviewed upward to 6 months. So all the female employees in Oyo State now enjoy 6 months maternity leave with full payments, including the weekend. So what led to this upward review? Well, we embarked on a series of advocacy to Oyo State House of Assembly, specifically targeting the Chairman House Committee on Health, Education, and Agriculture. Similarly, we held regular stakeholder meetings with different civil society organizations, non-governmental organizations, who also mount prayer on state legislature on the need to review the maternity leave for the female civil servants in Oyo State. Also, we disseminate the survey results in a survey result to update all nutrition stakeholders in the state, like result of make 5 and make 5 mix in the state, the nutrition aspect of the survey. So we disseminate it to various stakeholders, especially the nutrition stakeholder in the state. Similarly, the interaction of the past and the present First Lady with women, especially in the community, on the importance of exclusive breastfeeding and what governments need to do to encourage more women. So all this led to the issue of circular by the Office of the Head of Service when the Executive Governor has already approved it. Similarly, the activities of State Commission on Food and Nutrition in the state led to this achievement, because we have the representative of the chairman House Committee of Health, Nutrition and Education as part of the SCFN. So whatever decision we made at that meeting, so they gave report to their boss in the office. So these are the action we took that led to the issuance of circular, which reviewed the maternity leave of pregnant and nursing mother to 6 months instead of 4 months being enjoyed in the past. So what the state has benefited in this achievement is that it has afforded female employee, the nursing mother, to practice exclusive breastfeeding in the state. It also reduces the mortality rates in the state. It reduces the healthcare costs expended on children. So in the long run, health babies grow to become healthy adults who will eventually contribute to the economic development of the states. Well, step to extend the policy to the private sector. We have been appealing to some of the private sector corporate organizations to key in into this government initiative. So these are the steps being taken by the states toward ensuring the issuance of 6 months circular. I thank everybody there.
Thank you, sir. And I want to commend your state from moving from the 4 months to having 6 months paid maternity leave.
Yes,
and also, the last statement you mentioned was that there's been an appeal to the private sector to key into. What are some of the advocacy efforts around that?
We've been embarking on different advocacy to the private sector, non-governmental organization in the states on the reason that they must key into the government, this government initiative. We also, whenever we have a forum, because there's a forum, we used to hold meeting with some of this private sector, the NGOs, the CSO. We used to hold meeting with them. So during all this meeting, so we used to sensitize them on the need to key in into this government initiative.
Thank you, sir. And then we commend the efforts in the Oyo State government. I want to thank our panel speakers. Once again, Mr. Bashir Mohammed, Permanent Secretary, Planning and Budget Commission, Kaduna State, and Mrs. Bolanle, the State Nutrition Officer of the State Primary Healthcare Development Agency, Ekiti State. Thank you, all of our speakers. And now we will be moving on to the next session, which is the Q&A, questions and answers. So if anybody has a question for our First Lady, our state representatives, you can let us know. You can simply indicate by raising your hand, and then we would pass on the mic to you. Let's see. Okay, I see Christiana Uche has her hand up. Yes, Christiana.
Hello?
Yes.
Hello?
Yes.
Are you hearing me?
We can hear you.
Okay, good afternoon, everyone. I want to appreciate all the speakers, especially the First Ladies, our mothers, for the wonderful work they are doing. And I have a question I want to ask concerning early initiation. You see, most young women, mothers, especially the first mothers, their first delivery, it takes time for the breast milk to start flowing. And at times they get worried. because we learned that early initiation, the baby should be put to breast first, at least within the first hour of birth. But at times, even after 24 hours, that is a day, some of them find it difficult to get breast milk. The breast milk will not start flowing until at times, even the second day after 48 hours or thereabouts. So what should be the attitude, or what should be done? Because at that stage, you see the child crying, and the young mother get discouraged and feel so bad that she can't do anything to her baby. So what should be done? Because that is why at times you see, okay, the birth attendants, the nurses may say, okay, can we get a formula so that they will start at that early stage, and maybe after 24 hours or thereabout, then the milk starts flowing. So my concern is on that early initiation. And I want to thank the First Lady that mentioned about paternal leave, that 2 weeks paternal leave. There should be advocacy. The men, the husbands, should be really informed of the importance of staying with their wives, with the mothers at that early stage. In fact, you find out at times that the young baby, the newborn, the lips are not strong enough to hold the nipple. And so she or he will be crying. So I think at that first 2 weeks, I want the fathers to understand that they can help their wives even to suck the nipple. So when you tell them about bonding with the wife, they start laughing. They think it's a joking matter. So for them to open the nipples and help the baby to suck and the breast milk to start coming early, we go a long way to help us. And I also, on poverty, like our mommy said, making sure we bring out these mothers out of poverty is so important, because the baby takes in what the mother is taking. So if the mother doesn't feed well, then the baby is not feeding well. Again, dressing. Most of our young mothers don't dress well. They still do fashion and wear tight clothes. So when the baby needs to suck, they will be confused and they will be shy of giving baby breast milk. So in our advocacy, in our states, I think all these points should be mentioned. We should work on it so that we can all support the young mother for exclusive and sustained breastfeeding. Thank you.
Thank you, Ma. Thank you, Ma. And a very important question, that if some mothers are having difficulty being able to breastfeed, if that breast milk is not coming in, what would they do?
Yes.
And either our first ladies during the initiation stage. So our first ladies, you can address that question based on your own personal experiences.
Early initiation.
Yes, Ma.
Okay.
Well, personally, I'm sorry if I can speak. I didn't experience that kind of difficulty. As soon as the child is born, they place the baby on your chest so that the child can latch on, and they also place a lot of emphasis on the first flow that comes out. I think it's called the colostrum, which is supposed to be very rich in nutrients and it's supposed to be very good for the baby. I have no personal experience of people experiencing 24 hours to 48 hours of not being able to express or to produce or to lactate, to produce milk. I think that, yes, I know that it's always very extremely painful the first time the baby latches on and your uterus is shrinking and the pain can be excruciating. I think that for such mothers, they just need to be encouraged to continue. It's a painful process and it's an inevitable one. But maybe it's one of the things that they need to prepare the mothers, prepare them with before the baby is born, so that when it happens, it doesn't come to them as a shock. They know how to deal with it. So maybe a doctor would be able to, a medical doctor or a midwife, be able to explain scientifically the reason why this happens. But I didn't have that kind of experience.
Well, if I may, I actually had that experience. When I had my son, I had him by cesarean. They had to take him immediately to the ICU. And we went reunited for almost a day. And I struggled to breastfeed. I couldn't get anything out, and I started to cry.
Yeah.
So there was this woman, it was in a hospital in London. So there was this woman in the bed across from mine. She said, "Don't cry, my dear." She was older. She said, "Don't cry, my dear. What you should do is try and have a hot cup of tea. Try and have like 2 or 3 hot cups of hot tea and try again in a short while." And you know what? It worked. And I believe that is why they encourage new mothers, breastfeeding mothers, to drink a lot of fluids, whatever is available locally, whether it is pap or tea or, you know, custard, anything that can encourage, you know, the baby to suck and to make it work. But then Madam Uche spoke about the issue of poverty and women. I want to go back to that. It's extremely important, and I'd like our partners, both Save the Children and the government agencies, to take note. Women do not live their lives in boxes that can be ticked. So breastfeeding can't be kept in a separate box from women's poverty. It can't be kept in a separate box from family planning. We need to ensure that we have strategies that are linked so that women can have the best experience possible. A hungry woman, no matter how much she would want to, can't breastfeed. So we need to address the issue of women's poverty and livelihoods. Thank you.
Thank you.
Thank you, Your Excellency. Thank you for that question, for that response. I see that Mrs. Bolanle's hands are up. I want to know whether she has a response to that.
Thank you.
Yes.
Thank you. First of all, I want to appreciate the First Ladies for their contributions. But from my own experience as a nutritionist, I had an experience some years back. I was in one of the health facilities. So as I entered the place, I discovered that there was a woman who just delivered. So I went to them, I just greeted them. So the grandmothers and the mother-in-law, they were there with her. So they told me that her breast was not bringing, the woman was not lactating. So I told them what to do. So what I did was, I told the woman to stand up from the bed. So I will try as much as possible to describe this technique. It's a technique that we were taught at a training, that if a woman does not lactate in the within the first 24 hours of delivery. So the woman, I asked the woman to sit down on a plastic chair. So another plastic chair was brought directly in front of her. So the back of that plastic chair was facing the woman. The back of the plastic chair was facing the woman that just delivered. So what I did was I tilted the plastic chair backwards. You understand what I'm saying? It was tilted backwards and towards the woman. Please, are you hearing me?
Yes.
Okay.
We are hearing you, yes.
Okay, thank you.
Yes.
So I told the woman to hang her breast on the woman was now leaning forward, hanging her two breasts on that tilted, yes, on the tilted plastic chair. So when she did that, so what I did was I folded my fist, my two fists. Okay, my video is on now. So my two fists were like this. So what I did was I placed you can see my two thumbs up. Yeah, my two thumbs were up like this. So what I did was I placed my, let's assume, I placed my on her back as she was leaning forward on that plastic chair. So I placed my 2 parts of her back right above her buttocks. So I started massaging like this in a random motion. Oh, my 2 thumbs were touching her back. At the same time, bones were also touching her back. So I was massaging her up, from down, up to her shoulder level. So within 10 minutes, she started lactating. So that was what I did from the training that we were taught. Thank you.
Thank you.
Thank you. Thank you for providing that information.
That would be a good use of the paternity leave.
Yeah.
Thank you. Now we would only have time for one more question. Apologies, but we would only take one more question and then move on. I can see somebody had their hand up.
Hello.
Yes, yes.
Sorry, can I take my question?
Yes.
Okay. Good afternoon, everybody. I beg to stand on existing protocol. I want to appreciate all the speakers. They've spoken so well. My question is to the person that mentioned something about the informal sector, keying into the 6-month maternity leave. Please, I want the person to really expatiate on how this can work, because most of the people in this informal sector are either self-employed or they are employed by private, establishments. And some of these women have to go out every day to make a living. And sometimes they have to go out, the business they do is under very harsh weather. So it's not easy for them to take a newborn baby out like the dry season or rainy season or something. So how can the government support these people to make sure that they key into this exclusive breastfeeding, because they are also a large segment of our society? So that's my question. Hello.
Yes, thank you, ma'am.
Yeah.
Okay. Can I respond to that?
Yes, you can.
Okay, thank you, because it was me that told on that. Thank you. Like I said the government can implement additional policies like the maternity leave cash transfer.
Okay.
It has been a practice done in other developed countries, like I mentioned Indonesia. And I mentioned that this policy amounts to less than 0.5% of the gross domestic product. So what that means that the financial implication is not much on the economy of the state. But regardless of that, I also added that if the
regular iPad. I'm sorry.
Yes, ma'am, please.
Can I go on?
Yes, you can go on, continue.
Okay. So I also mentioned that if the state government is buoyant enough financially to do that program, we already have a program on ground in the federal government. We have this cash transfer program for the less privileged. So this is also related to it. So if the government can key into it, it is called maternity leave cash transfer. So if those mothers, it is just a suggestion and what the government can do for the less privileged in the community. Have I been able to shed more light on it?
Thank you. I think you have.
Okay, thank you.
Thank you, Ozo Amaka, for that question. And unfortunately, we can't take any more questions, but I encourage you to continue to reach out to your state reps and your first ladies to see how you can advocate for better policies in your states. And now I want to move on to our call to action and closing remarks from Save the Children. So I would be calling on Mr. Innocent to take the closing remarks.
All right, thank you very much, Isioma. Your Excellencies, distinguished colleagues, ladies and gentlemen, I want to plead that you permit me to stand on the existing protocols. First, let me thank Your Excellencies for participating in this webinar. We have learned so much from you, and we're excited that some of you have practiced exclusive breastfeeding and have taken a lot of action towards improving and ensuring that the women from your state are breastfeeding exclusively. At Save the Children, we're excited about that, and we encourage that action continues to happen. I think it's important that we highlight what exclusive breastfeeding is for the purpose and for the interest of so many people who may think that you can add something. So for us, exclusive breastfeeding is giving baby only breast milk from birth for the first 6 months of life. And this means no water, no tea, no other foods, can be given, within this period. So breastfeeding protects the baby from infections such as respiratory diseases like pneumonia and others like diarrhea. It has also economic impact, especially on the household income. We are talking about poverty, but that little money that comes into the household, if the mother understands what exclusive breastfeeding is and practice that little money that is used for baby formula can also be saved for the family to be used for other things. Other things is that it creates a better bond between the mother and the baby, and improves the cognitive development of the baby. That helps that baby to perform better in school and all that. So there are several reasons why breastfeeding a baby exclusively is very important. Now I move to we recognize that there are some challenges that have hampered exclusive breastfeeding in so many families. We recognize that, and some of them are either the household chores, which the breastfeeding mother has to do. Some also experience sore nipples. Some also have low production of this breast milk. For some that are working, they experience short maternity leave periods. We had the experience of somebody telling us that she was given only 2 months, some 1 month. And all of these are big challenges that lactating mothers face in the workplaces. Lack of support from health workers and most importantly, our grandparents. You will hear people talking about give that baby water to drink. And I'm happy with the way our first ladies address this very point. So when a mother is not able to breastfeed her baby, she most times suffer this psychological discomfort, and that lowers her confidence, because she's not able to do what she's supposed to do. However, we have this following call to actions, because we feel that if we work together as stakeholders in nutrition and in health, we can actually improve the environment and make things better for our women and for our children. For breastfeeding to be successful, a mother needs a supportive environment at home, at workplace, and in religious places. They need this very supportive environment. And so we are asking that this supportive environment be also created. Government also should protect, promote, and support exclusive breastfeeding by enforcing the full implementation of BMS code, to end exploitative marketing of breast milk substitute. There's an international breast milk substitute code. We want to encourage that government should ensure that that code be implemented 100%, because that will help improve exclusive breastfeeding. Employers, in this case, we are referring to government in particular, because government is the highest employer of labor. They should encourage exclusive breastfeeding by having corporate policies that promote it, that provide conducive area like crèches, for breastfeeding activities, and prioritize maternal and paternal rights. Breastfeeding can suffer, during an emergency situation, and we have several IDP camps all over the places in the country, And so we want to advise that in these IDP camps, opportunities are created for these women to receive advice, encouragement, and counseling on how to exclusively breastfeed their babies and practice infant feeding properly. Government should also indeed, and other stakeholders should make conscious efforts to reach out to the informal sector. I am happy about the conversation we've had about the informal sectors. So we should develop awareness and sensitization activities that are targeting these individuals, like Okada Men, the Market Women Association, and all that, for them to be able to understand what they are supposed to do. There should be also efforts to sustain zero water campaign. We are happy that the federal government started this zero water campaign, and we want it to be sustained, because if you look at the statistics, you will see that our mothers are actually breastfeeding our babies, but they are not doing it properly because they introduce water at some point. So zero water campaign should be sustained. The other point is full implementation of the multi-sectoral plan of action for food and nutrition. This has been adopted at national and state government have been adopting it, but we want it to be fully implemented. The other point is government should include nutrition education in school curriculum. It is important because it is part of the conversations we had a few minutes ago. Our young girls should understand the need for exclusive breastfeeding and be part of this as they are growing up. So it is important that we incorporate this in their school curriculum so that they will be able to get the understanding, get the information, get the knowledge as they grow up. The other point is we need all stakeholders need to strengthen effort to perfect the creation of a nutrition department and the budget lines for nutrition activities in all line ministries, both at national and at subnational level. We are happy that our president has approved the creation of the nutrition department in relevant line MDAs. We are happy that this has been done, but we want the country to progress very fast by creating nutrition department both at national and at state level, as well as creating budget lines, because all these activities we mentioned, we cannot achieve them if there is no budget line and monies are not being released. This state government should also adopt and implement maternal, infant, and young child feeding policy. That these policies have been approved at national, and we're encouraging state government to adopt it. It has been, it has a robust processes and procedures that state governments need to follow in carrying out social mobilization activities to encourage women. The second to the last point is the general public should also hear awareness about exclusive breastfeeding and be respectful to breastfeeding mothers. Most times, people look down on women that are breastfeeding their babies, even in public, and we are not able to support them, even at household level. So it is a responsibility that is for everybody, and we're encouraging that we should do this judiciously to encourage our children. Government should strengthen the capacity of health workers to provide counseling at infant and young on infant and young child feeding practices, and also ensure resuscitation of baby-friendly hospitals initiative across health facilities in Nigeria. We had this in the past. There are a lot of results and testimonies that came from this. We don't know what has happened. We are pleading with our with governments to ensure that they look into all of this and see how all of this can be resuscitated again. Finally, we want to thank Nigerian Governors Wives Forum for being part of this. And we're happy that you participated in your numbers, even though the arrangement was very short, but we're happy. But as ambassadors and champions, we want to encourage you to influence your husbands, who are the governors of various states, to create an enabling environment for nutrition activities in your various states, especially ensuring that funding are released timely to relevant ministry to implement activities that will improve our human capital development indices. This is our prayer. We are praying this prayer on behalf of Nigerian children. We are praying this prayer on behalf of civil society organizations in Nigeria, because we are committed. We know what you can do. We know the influence you have on your husbands. We know the influence you have in the states, and we cannot improve these indices cannot improve until you intervene. As political parties start electionary campaign, this is an opportunity to bring nutrition and well-being of Nigerian children at the center of the political discourse. We remain committed to the cause for greater investment in combating malnutrition, as well as work together to attain a country where everyone has food and is nutrition secured. Long live Federal Republic of Nigeria. Thank you and remain blessed. God bless you all. Thank you.
Thank you so much for sharing your call to action, Mr. Innocent Ifedilichukwu. And that brings our event to a close. We want to say a special thank you to Your Excellencies for joining us, for sharing your depth of knowledge and experience and enriching this webinar in the way that you have. We hope to continue to hear more from you about your efforts, and also to continue to see some of the impact of the work that you're doing. We want to thank our partners at the Nigeria Governors Forum for their effort and collaboration, and also at the Nigeria Governors Wives Forum for the effort and collaboration, and all the work that has been done to put this event together. I also want to say thank you to everybody who has joined in, participated, listened, shared comments, shared questions, and really enriched this session in your own way as well. And so with that, we'll be bringing this webinar to a close. And we encourage you to continue to celebrate World Breastfeeding Week up until the 7th of this month, and continue to share some of the activities that we've done, and even the conversations that we've had. Please share with family and friends and on social media. And we wish you a brilliant rest of the World Breastfeeding Week. Thank you so much.
Thank you, everyone.
Thank you, Mariam. Thank you,
Thank you, everyone.
Thank you, Your Excellency.
Thank you. Thank you, everyone.
Bye.
Bye.